Imagine this. A majority of people who have gallstones aren't even aware they have them. These so-called silent gallstones often remain undetected, only to be discovered during an ultrasound or CT scan done for other reasons. Quite the covert health issue, isn't it? Now, one might wonder, what exactly are gallstones? In simple terms, gallstones are hard, pebble-like deposits that form within the gallbladder, a small organ located under the liver. These stones can range in size from as small as a grain of sand to as large as a golf ball. They are formed when there is an imbalance in the substances that make up bile, a liquid produced by the liver to aid in digestion. Silent gallstones, despite their lack of symptoms, require attention as they can lead to gallstone disease. The most common initial symptom of gallstones is biliary colic, also known as gallstone pain. This typically manifests as attacks of abdominal pain, often located in the right upper belly just under the lower ribs. It may also be felt in the upper center of the abdomen or even in the lower chest, sometimes causing it to be confused with angina or a heart attack. Accompanying symptoms may include nausea, vomiting, and pain in the right shoulder or back. Biliary colic usually occurs when the gallbladder contracts in response to a fatty meal, compressing the stones against the gallbladder outlet and blocking its opening. The pain subsides several hours after the meal as the gallbladder relaxes. Interestingly, in some people, the pain occurs without having eaten anything and often starts around or after midnight. Once the first attack of biliary colic occurs, there is a possibility of more severe and recurrent symptoms in the future, occasionally associated with complications. Gallstones can lead to serious complications such as acute cholecystitis, which is the inflammation of the gallbladder caused by a complete blockage from a gallstone. Unlike biliary colic, which resolves within a few hours, the pain from acute cholecystitis is constant and fever is common. This condition requires immediate medical treatment, typically involving IV fluids, pain medicine, antibiotics, and often surgery to remove the gallbladder and its contained stones. Another complication is choledocholithiasis, which can occur if one or more gallstones leave the gallbladder and block the main bile ducts. This can lead to jaundice, a yellow discoloration of the skin and eyes, acute cholangitis, an infection of the bile ducts, and acute pancreatitis, a sudden inflammation of the pancreas. All these conditions require prompt medical attention. To wrap up, gallstones are a common but often silent health issue that can lead to significant complications if left untreated. Awareness of the initial symptoms, such as biliary colic, is essential to ensure timely medical intervention and prevent severe health consequences. Remember, when it comes to health, prevention is always better than cure.